Okay, everybody, we are live. Hello, everyone. Welcome to IHA's webinar, Create Consent Forms Patients Can Understand with Becca Austin. She's a patient education specialist at Henry Ford Health. My name is Jill Patton. I am the content manager for IHA, and I'm filling in today for Julie McKinney. So I'd like to welcome Becca. Becca, like I said, is a patient education specialist with the organizational health literacy and patient education team at the Henry Ford Health in Detroit, Michigan. She has a background in sports medicine and as an athletic trainer. And in that role, she realized the best part of her job was empowering patients to understand and act on their health information. So she went back and got her master's degree in health studies and education and joined the organizational health literacy team at Henry Ford Health in 2019. And I'm going to just advance the slide to some housekeeping stuff. And I'll add some of this to the comments as well. We are recording this webinar and we'll post the session on the Health Literacy Solutions Center in the webinars page under previous webinars. Please use the chat for comments and discussions related to the webinar or in response to prompts Becca might have in her presentation, and use the Q&A feature if you have questions for Becca. We will moderate these and share them with her, and she'll be able to respond at the end of today's presentation as time allows. If you're having technical issues, I'll send that information as well for, you'll need to send an email to our tech support. And to get CE credits, please submit the evaluation you'll receive after this webinar. So I think I'll just go ahead and turn this over to Becca. Becca, thank you again for being here. Thanks everyone else, and I hope you enjoy this presentation.
Thanks, Jill. Thank you so much. Good afternoon or good morning, I guess, depending on where you're joining. It's afternoon here in Michigan. So I'm here today to talk to you a little bit about health literacy consideration and strategies for patient signature forms. So our learning objectives today are, by the end of the presentation, you should be able to articulate the importance of plain language in patient signature forms, identify key stakeholders to facilitate process change around patient signature forms, identify at least 3 types of patient signature forms and the contents of each, and identify at least 3 ways to improve the design of patient signature forms. So just a loose agenda, we'll do introduction really quickly, although Jill had a fabulous introduction for me. A little bit of background, we'll get into the nitty gritty about what to do and how to get started, ongoing opportunities and takeaways. So just Jill did it, like I said, Jill did a great job of my introduction, but again, just so you have a little bit of background, my name is Becca. I'm a patient education specialist with Henry Ford Health in Detroit. My background is sports medicine, so I worked clinically for about 8 years with the sports medicine department. I worked for a couple of years in community health and then joined our organizational health literacy team in 2019, where I serve as one of our primary writers for the system. Just a little bit of background about Henry Ford Health if you're not familiar. Again, we're based in Detroit, Michigan, Southeast Michigan. We are a relatively large organization and still growing with more hospitals and medical groups joining every day. And I share this context actually just so that you have a little bit of knowledge about when I talk about process change and implementation. I work for a fairly large organization. And so when I say it takes time, I understand it truly does take time to implement process change. And hopefully through the presentation, you'll still take away some tangible next steps for you at your organization, whether large or small. So I'll share a little bit of background. Again, we'll go into background and then some of the further details. And I actually have a couple of prompts throughout the presentation just to get you thinking. And so I have 2 questions. And like Jill mentioned, if you could just put it in the chat, whether yes or no, have you or someone you know signed a healthcare form and not fully understood what you signed or why you signed it? So I'll just give everyone about 10 seconds to put that in the chat. Great. And so our next question, I can't see what you're all responding, but hopefully I think I'm seeing a lot of yeses potentially coming through. So the next question, have you or someone you know signed a healthcare form without actually reading it? So the first one was more you kind of read it, you didn't know. And then now, have you or someone you know signed it without actually reading it? So we'll give you about 10 seconds. Awesome. So yeah, there's a little bit of a lag, but I'm seeing a lot of yeses coming through. So keep keep them coming as you answer the questions. But this kind of really our little sample size here of all the yeses and of courses is really largely supported in the literature as well. So this study that I have here on the screen for you is in 2014, so 10 years ago. And you can see that this was a problem and has been an ongoing problem 10 years ago today, even longer. And so in particular in this study, you'll see out of 522 patients, over half reported they did not actually read the informed consent. And then I have two that are kind of starred because we can actually talk a little bit about how we can change those numbers today, perhaps within our own organization. But 11.9% found it difficult to understand, and then 5.2% found it frightening and gave up reading. So I think this is only one study, and again, it is largely supported in the literature everywhere, and that most people don't understand what they're reading or they don't know why they're reading it. And so the consent forms in healthcare fail to achieve their intended purpose, right? And that's a huge health literacy concern. It's a huge patient equity concern. So why does this matter? Again, none of this information on this slide is going to be new or surprising to any of you. It's really just the justification for why we continue to work on our organizational health literacy efforts. And so specific to forms, we also know that oftentimes our forms are serving as the education for our patients. Whether that's right or wrong is probably a whole separate webinar, but I think it's important to know that as it serves as education, our patients need to know why they're signing it, what they're signing. And by doing that, we can help, again, address health literacy. We can increase the use of preventative health care, help patients better manage their chronic conditions, improve health outcomes, etc. So again, nothing new here on this slide to any of you. It's just, again, the emphasis of the importance of health literacy. And that also applies, again, similarly to patient signature forms, because that's just a piece of the health literacy puzzle. So again, just as a reminder, again, this is not new information to any of you, the importance of health literacy for our patients. And when we talk about what we do from an organizational perspective, we're trying to make sure information is accessible, understandable, and then ultimately we're empowering our patients. So when it comes to consent forms or patient signature forms, can the patient find accurate information on what they agree to or consent to? Is it on the form? Do they have to look elsewhere? Where in the heck are they supposed to find the information? Is it available in a language the patient understands? Is it available in paper format, electronic format? Again, whatever is most accessible to the patient. And then once they find the information, so once they know what they're signing and why they're what they're signing, do they know why they're signing it? Is the legal jargon removed or at least explained in plain language? And again, we'll kind of get to that when we talk about our legal affairs partners, because sometimes we can't always remove the legal language, but is there an opportunity to explain it in plain language as well? And then ultimately, we are looking to empower our patients, right? So they can understand the information and now they can ask the appropriate questions and they can make the choice that's right for them, which is ultimately our end goal for our patients. So another question, again, just to kind of get you thinking as we shift gears into what the meat of this presentation is about. Do you think there's an opportunity at your organization to review and implement changes around patient signature forms? And if yes, in a word or two, what do you think some of those opportunities might be? So I'm going to give everyone about 10 seconds to think about it. Hopefully you're all going to say yes, which is why you're here today. But share your opportunities in the chat, again, just for the sake of everyone else as well. Yeah, so one of them I'm seeing immediately is yes, we need less words in ours. And I can say the same. We have many programs and too many forms. Also relatable. So, yes, go ahead and keep putting those in there. And I think we can all agree on a lot of the reason we need to update forms within our organization. And so just to kind of level set for the purpose of the presentation today, I am attempting to simplify a process that is not simple by any means. We know for an equitable patient signature process, there's a lot that goes into it. So we need those easy to read forms. We need the plain language and formatted forms. We need a system policy and standard workflow that support our patients. System-wide communication, accessibility, organizational and leadership support, provider patient communication. I could go on and on. This is not even an all-inclusive list here. So I just want to say, again, to level set, we understand that this patient signature process, to make it equitable, to address health literacy, takes time. And for the purpose of our presentation today, I'm hopeful to share some tips for you around the easy to read forms and then a little bit into the system policy and standard workflow. So when we talk about forms, we'll talk about different types, templates, requirements, and then we'll talk about system policy and standard workflow just a little bit towards the end as far as how do we get stakeholders involved, reviewing and approving the various forms. So let's get started. That's why you're all here today. So again, trying to make a very complicated process relatively simple, I've identified 5 steps here as far as getting started at your organization. And so again, these are not, they are organized in a step fashion. It does not mean they don't happen simultaneously. It doesn't mean they may not happen out of order. They may happen out of order. And so this is, again, for the clarity of our presentation today, I'll kind of go through these steps one by one. And again, just keeping in mind that depending on your organization, you may be able to skip steps, you may be able to rearrange them, but we do think all of these steps are very, very important as you work through this process within your organization. So this first one, organization process review and fact finding with best practices from the literature in mind. So when we talk about process review and fact finding, this is the deep dive into your organization. This is where you are going to ask all the questions, you're going to talk to all the people, and honestly, this will take a lot of time. And maybe you already have some of this, which is really helpful. I know when we started, we really didn't. And so here are some of the questions you want to consider. Who owns the process? How did they come to own it? What technology is used? Who else reviews the forms? Who has the say in what the forms look like? Is there opportunity to change them? How often are they reviewed? Is there policy? And more. So again, this is just a snapshot of the questions you want to ask. And again, this will take time. So for us, when we kind of started this work within our organization, we actually had just a little foot in the door initially. So we were called in to review forms from just a plain language readability perspective. We were not allowed to really do anything else. We couldn't look at formatting. We weren't really allowed to make comments about much else. We kind of had to stay within our lane when we were first invited in. And that could be really frustrating from a time, again, as a health literacy expert, as people who know kind of the formatting and the plain language and addressing that for our patients, it can be really frustrating. And yet we also found it really, really great for us to do this process review and fact finding. So we were able to ask some questions, kind of build relationships that took a little bit of time for us to build, which we'll talk about some stakeholders and relationship building as well. And so maybe that could be an in for you, that first step in the door. Otherwise, you may be able to dive right in and really get to the nitty gritty. You may already have approval to work on this and you can just dive in and start asking all the questions. And so sometimes I know other organizations, we have to do it a little bit more cautiously. And again, nothing new on this slide, but as you're doing that process review, keep those health literacy best practices in mind, which I think you all have identified even within the chat about how do we make these easier to understand, simplify, etc. And so these aren't surprising, they're not new, and just keep them in mind as you do that process review within your organization. And ultimately remembering we're trying to make this so we can access and understand, our patients can access and understand, so we ultimately empower them. So again, defining the form type, plain language, formatting, purpose, action, etc. Again, we'll talk about some of this as we talk about the different types of forms when we get there. Just keep these in mind as you're doing that process review to start understanding the opportunities in your organization a little bit better. Additionally, something to keep in mind as you're doing your process review and looking for justification, because I know a lot of organizations want that justification of why are we doing this? Why is so and so coming from the health literacy area saying we need to redo this? And so this is just again one Joint Commission safety recommendation as far as it's a newsletter dedicated to informed consent. And they have several action items around how do we improve the informed consent process and informed consent forms. This is not unique. So Joint Commission has them, CMS has them, AMA has guidelines, etc. So think about your regulatory bodies. Again, even if you're outside of healthcare or perhaps a supporting organization, you likely have regulatory bodies or accrediting bodies that have information about addressing this. Health literacy is becoming, I think, really, really important and to the forefront of a lot of minds. And so you can find the justification within those regulatory agencies as well. So again, as you're doing your process review, finding the opportunities with health literacy in mind, keep in mind also that we have these regulatory bodies that are supporting the work as well. And similarly, as again, this is a big step, there's a lot that goes into it. As you're going through this entire process, it's also important in your, whether in your head or you write it out. I know I have pages of notes on this myself. You want to outline your buy in. And that's more, again, we have the evidence supporting the literature of why we should address this. We have the regulatory bodies saying, yep, you really want to do this. We have our health literacy experts saying, yeah, you definitely want to do this. And when we talk about stakeholders, sometimes that health literacy doesn't always resonate with them, or it just doesn't seem to really make an impact one way or the other as far as getting your partners on board. And one of the things we found really helpful was kind of appealing to the humanity of individuals. So when we worked with our legal affairs and our health information management team, which again I'll share more about, we found that we all just wanted to save some time and energy when it came to the patient signature forms. So we were all working really, really hard to update forms and to approve them, and it was going all over the place. Our map of what it looked like was not clear. It was very difficult to follow. And so when we originally brought this idea to our team, everyone said, yeah, man, this is going to save us a lot of time and energy. We will have standard language that we don't have to approve every time. And then we just have to review the form specific information to make sure it meets our best practices. It can help in the reduction in the number of forms. And so I think I saw that in the chat as an opportunity. Is there's a lot of forms and why do we all have them? And so this was a way that we found we could help reduce the number of forms. As we were looking through, we were going, wait a second, why do we have this form? Why is this here? We talked to the content owner and they're like, well, we just felt it needed to be there. And then we talked to legal and regulatory and they all say, no, we actually don't need that form. And so we helped reduce the number of forms. And then our leadership was really, really interested in the clearly defined streamlined workflow and approval process. So once we had the form, once we had the approved content, we needed to have the right people looking at the form to ultimately approve that. And that was something that was really missing in our organization. And so when we brought this to leadership and we showed them that step-by-step nature, they said, oh, thumbs up. Yes, we definitely want to do that. And so again, we'll talk a little bit more about that, but this is again appealing to the humanity of our fellow colleagues, really, and understanding that they have an expertise, so we respect their expertise just as we would want them to respect ours in health literacy. So that's kind of the process review and fact finding. You want to find out more information. Again, within healthcare, you don't just have informed consent, and we'll talk about that as well. We have a lot of other types of forms that are signed within healthcare. And again, that'll be the third step we talk a little bit more about, but that'll be part of your process review and fact finding is figuring out what truly is informed consent, what is not, etc. So then your next step as you're doing that process review and talking to people is you're going to start to get the right people involved, because as much as we would love to do it all from a health literacy expert perspective as far as the formatting and the language and things like that, we also know that patient signature forms have a lot more that go into it. There's legal requirements, there's regulatory requirements, and so as much as we would like everything we say to be the truth and what everyone goes off of, that's not always the case. And so we want to get the right people involved. So you're all probably going to roll your eyes at this slide. Collaboration is key. And I put this up here again, understanding that this will take a lot of time. The process review, finding the right people who need to be involved can take a lot of time. And not only to find the people, but to build those relationships. As I mentioned, when we first started, our legal team was a little bit more difficult to get on board with what we were hoping to do versus what their objective was when it came to a form. And so we really had to build that partnership, and we really had to meet with them regularly. And I know when we've talked about this at other conferences or with other professionals, that's a similar concern is, oh no, legal said we have to have it this way or something like that. And so that is one relationship. Again, we'll talk about our stakeholders and our teams in the next couple of slides, but just keep in mind that you really want to collaborate. You want to respect the expertises because they are important. And when it comes to legal, one of the things that our legal partner informed me of pretty early on was when it comes to forms, there is a risk tolerance depending on your organization, depending on the form. And so, for example, informed consent, when we talk about a medical or surgical procedure, has a much higher risk tolerance, meaning there's a much higher risk for the organization. And so we need to make sure that it is clearly defined. We have everything where it needs to be for the sake of our organization, and then more importantly, for the sake of our patients. And then the little picture of the mountain, as I mentioned, I work as a primary writer for our organization when it comes to education. And one of our nurses that I work really closely with, who we were really in the trenches of trying to figure out for her specific department what the education looks like, why it was so scattered, and trying to really streamline and address health literacy for our patients. And she told me a quote that I have to remind myself of daily, and it's, "You're moving the mountain one pebble at a time." And I think that's true for everything health literacy, and then specifically as we talk today about the whole patient signature process, about finding the right people to collaborate with and getting everybody on board. So just keep that in mind as we do this. So identify and engage stakeholders. So again, as I mentioned, this is not actually an all-inclusive list, and this is something that you'll start to find as you do your process review and start talking to all of the people that you need to be talking to. This, again, not an all-inclusive list, and some of these names may be different depending on your organization, but the concepts are largely the same. So health literacy experts, again, I think that's pretty self-explanatory about why we want to be at the table and need to be at the table. Legal affairs, which again I've alluded to already, are legal language and legal implications experts. And again, when I talked to our legal partner, just kind of letting her know I was presenting today and if there was anything I could say on behalf of legal. And it really was just work to create that partnership as best you can, because they are the risk tolerance and the legal experts. And as much as frustrating as that can be sometimes, there is also a really grand purpose to what they do. And so they're a really great partner to get on board and keep working on that relationship. Your quality administration. So these are your regulatory compliance experts and your policy experts. In our organization, these are the gems of our organization, if I'm being honest. So these are our partners that can take a 400-page CMS guidelines report on what needs to be in a particular patient signature form and break it down for me in 2 sentences that says, yep, you need this, or no, you don't need this, and this is why. And so, for example, we worked on a hospice patient signature form recently. It was an agreement form, and we thought we were going to have to redo the entire form based on someone's perception of the CMS guidelines. And when we went to our quality team and asked them to advise on what they were seeing, they said, nope, you don't. They gave me 4 pages worth of evidence, and then at the end of the day just said, no, you don't need to change anything. So these are really great people to have on board, in addition to legal, that again will help us understand, okay, what's required from Joint Commission or regulatory bodies and what's not, and what can we change and what can't we change. Health information management. So this is the team in our organization that actually owned the patient signature process historically. I think as long as I can go back, or as long as we know, it's been our health information management team. And this is the team that helps us manage the medical records. They can scan it, and if there's any downtime forms or paper forms that are signed still, they can scan them into the record. They help patients if there's information that doesn't belong in the record, etc. So these are the people, again, that help with the medical record, and they were instrumental in our work just because they were the original owners, so they had all of the information, but they may be a partner for you too as you think about who needs to be involved in the process. Leadership, clinical leadership. other leadership, whatever that looks like at your organization, whether that's system councils, whether that's experts, whatever that looks like at your organization. And what we found with our leadership is usually, we got the thumbs up to move forward with addressing this process and creating new templates and forms and things like that. And then at the end of the day, they were just like, send us some updates when you have them kind of situation. So these could be the people that just give you the thumbs up and they want the information down the road, or they could want to be more involved. And so again, that's going to depend on your organization and your leadership structure. And then information technology, these are our e-signature technology experts. So they're the ones in the back end that help us build our forms into our Epic, which is, our patient electronic medical record that we use at Henry Ford. And so they're the ones that can help us build it in on the back end. And so similarly, they didn't need to be overly involved from the start, but they do get more involved as we were developing everything moving forward. So once you kind of have an idea of your stakeholders, you know who needs to be involved, then you start to prioritize to create that team that's really going to work the day in and day out of this process update and updating your templates and your forms and things like that. All of our stakeholders are important. So that's not to say they're not important. It's just to say that sometimes there can be that too many cooks in the kitchen situation where we have too many people trying to weigh in. And sometimes you're wondering, well, why does this person have so much of a say, right? Is that important? And so for us, for the day in and day out, as far as getting some of the language updated and the formatting and things like that, it was our team, the legal team, and the health information management team. And again, we brought people in, so quality, they got updated regularly. Leadership, not quite as often. They just kind of get updated as we continue to move forward in the process. So again, that may look different at your organization. But this was the team that when we first started, they were really willing to sit down with us and meet pretty weekly. My team, we took the brunt of this work. We took it on as much as possible. And then this was the team that was willing to meet weekly to review what the forms looked like, the language, etc. So that's ideal in your organization as well, is to just figure out that small group that's willing to do that, and then figure out who needs the communication otherwise, whether that's biweekly, weekly, monthly, etc. So we'll just pause for a moment, thinking of your organization, who's missing from that stakeholders list that would be key to updating and improving forms work for you. And again, we know all organizations are a little bit different, so it would be helpful if you can share some of those just from your perspective, just in case there's someone that's really missing that might inspire others. So I'll give you about 10 seconds to think about it, and you can keep putting that in the chat as you see fit. Perfect. Yeah, of course, patients. So we'll talk about that actually. They definitely, we had them more involved kind of once we figured out our process, but definitely patients, risk, marketing. So go ahead and keep putting those in there. I think it's really helpful for everyone to see if there's other, just to inspire you as you think about your organization. So let's talk about defining form types and creating templates for each. So just again to level set, when we talk about patient signature forms and processes, I think I'm seeing a little bit of this happening in the chat. What you have to understand is actually when you dive into this, especially something we found in our organization, is that most organizations do not differentiate between types of patient signature forms. And there is a really big importance to doing so, which we'll kind of talk about as you see how we define these types of forms and how we came up with our templates and things like that. But largely, it's really important for patient understanding and engagement. For each of our form types that we've identified in our system, we have standard language at the top that says, this is the type of form you're signing, this is why you're signing it, and then the information below is what you understand and agree to. So you'll see that again when we talk about the templates and the definition of each of these forms. And then it's also important from an organizational perspective, because this is what's going to help you understand what the process for creation, approval, and implementation looks like. So again, all of these forms are different. So when we talk about informed consent, that is the most strict regulated type of consent form and process. So it's not just a form, it's a process as well. That is, again, you can find instructions from the Joint Commission, CMS, AMA, all about what informed consent looks like. And you can see at the bottom here in the purple asterisks I have as far as what the three major components that are required from an informed consent process are. And again, these are very, very broad, because there's a lot of information that goes into it. And I think we could have an entire separate webinar, maybe 2 hours worth, about the informed consent process. So again, keeping in mind, we're talking today about the variety of patient signature forms that exist within a healthcare organization. And when we talk about informed consent, determining the competence or capacity of the patient to consent, informing the patient with effective communication, and documenting in the health record. Again, that's really, really broad. And this is very, very specific. So we'll talk a little bit about it when we talk about consent form as one of our types of forms. But we believe, especially at Henry Ford, and probably something you all can agree with us on as well, is that regardless of the type of form that a patient is signing, they should still be going through a fully informed process, which we know they're not always. And that's, again, when we talk about opportunities at the end of our presentation today, that's an opportunity, right? Is that something that really needs to be largely addressed within organizations? And again, a little bit outside of the scope of our presentation today, but again, just to reiterate, we do feel strongly that regardless of the type of form that the patient is signing, it should be a fully informed process. So within our organization, and through the help of some other organizations that we worked with in our health information management and legal team, who were our key partners in doing this initial kind of work, boots on the ground work, we identified these 4 kind of buckets of forms that exist within our organization. And as you look through here, different types of forms, you'll probably realize that these could be very largely applicable to your organization. And you may also find some opportunities for some wiggle room or potentially another type of form. So let's talk about each of these buckets of forms. We'll show you some templates and some standard language that we came up with for each of them. So as I mentioned, with a consent form, and particularly an informed consent form, it is a signed document where a patient agrees or disagrees to a medical intervention and has the right to agree what happens to their body. Again, please keep in mind, for the sake of this presentation, I have tried to make this as simple as possible. We know that there's a lot more that goes into this. And so for our organization, the primary example is our consent to surgical, medical, or diagnostic procedures. So you'll probably have that if you work in healthcare as well in your organization. And so the template I'll share even on the next slide is actually just the template. What our actual consent to surgical, medical, or diagnostic procedure form looks like is far more complex, just because of the nature. But again, I share the template because we use that if there's an opportunity for other consent forms within our organization, although they all largely kind of fall into this one type of form. So when we talk about requirements, this was our team, this was our stakeholder kind of coming up with these requirements for each of the types of forms. And again, very simplified for the purpose of the presentation today. From our perspective in health literacy, you'll see with all of the forms, plain language is a must. We do require it, and we have worked to partner with our legal team to figure that out. And so that's a requirement, and what that looks like may differ for your organization. We use readability as a tool, but that's not the end all be all for us when we talk about plain language. And so that's something to consider. Again, from an informed consent and legal and regulatory standpoint, it must include things like diagnosis or condition, plan procedure, site of procedure, specific risks, benefits, alternatives, etc. So there's a lot more that goes into it. But again, that is required from a legal and regulatory perspective. And then we have some standard language that you'll see on our template that defines consent. It talks, what the patient's agreeing to, how it's laid out. These were, again, agreed upon by legal, by our team, by regulatory, etc., and all the people that kind of needs to give us a thumbs up on what the templates looked like. So again, keeping in mind as you do this within your own organization, this is the most detailed type of form we'll talk about. It does need to be accompanied, again, very, very general, by education, so that the patient is not just getting a form, they are getting a fully informed process. So they're getting the education, the opportunity to ask questions, etc. And again, this one has the most regulatory requirements and has, again, one of the higher risk tolerances from a legal perspective, which is why it does need to be so overly detailed. So this might be a little bit difficult for you to see. And this is just, again, a template that we came up with, and I'll share about with all the other forms as well at our organization. So you can see there's things highlighted in yellow. So anything that's highlighted in yellow, that is where whoever owns the form, who our content experts are, doctors, nurses, leadership, administration, etc., are able to go in and type out what exactly we need on their particular form. So anything else that's not in yellow, this is all locked text. This is all standard text that our employees actually cannot change, because those are that is the agreed upon text from our, again, legal, health literacy, regulatory team, etc. So that's agreed upon text. So I know it's hard to read, so I'll read that for you. At the very top, it says, I understand that I have the right to direct what happens to my body. By signing this consent form, I agree to what is described below. And then you can see there's different headers. And again, this is where our employees will go fill out the appropriate information. I give consent to the procedure, the risks, the alternatives, what their agreement is. And then in the yellow, that's where we also recommend what we need the employees to put in that section so that they're guided a little bit. Again, we'll at the end of this review it for plain language and, again, legal considerations, but having this template makes it significantly easier because we know where to go to look for the certain information. So for example, under I give consent to, we ask the employee to use this section to explain what the patient is giving consent to. So the description of the treatment or interventions, the purpose of the treatment or interventions, and then we ask them that the text be written in first person, so I instead of you. So again, those are our guidelines. That is what our team ultimately agreed upon and what this needs to look like. And again, it's going to look a little bit more robust when it gets filled in. But again, by having this template, by having an opportunity for our employees to go fill in the information, we then, again, can just go directly to the places that our employees filled the information in, rather than trying to go through the whole form and try and break it up when someone just copy and paste a bunch of text in there. So just for the purpose of this form, I don't have it outlined for all the other forms, but just so you can see, again, the different pieces of this form and the different people that went through and said, yep, this is how we want to have it done. This is what we want it to look like. And so the blue boxes, so for example, that header, putting the patient label, the other headers, like I give consent to, procedure, and that nice box, the signature area, those were all agreed upon, again, by legal, regulatory, health information management, and ourselves. And then things like the procedure, the risks, the alternatives, again, those are the regulatory and legal requirements. And then the language at the very top was something we worked with legal to make sure we approved on all of our forms. So that, again, we're telling the patient at the very top, okay, what is the purpose generally of this form? Why am I looking at this form? Why am I signing it? And then the exact details of why they're signing it are below. And again, you'll see that on the other forms as well that I'll be able to read to you when we get to them. And then at the very bottom, for the sake of our organization and keeping these all organized, we have a form number, the revision date, and then the type of form. So this is obviously a consent form. So we have all of that on the bottom, just again to help our organization know we're using the most up-to-date type of form. So agreement form, this is another type of form you may see in your organization, and I'll jump really quickly to the bottom, but we have found in our organization that this is the majority of forms that we have in the system. So we have our large surgical medical diagnostic procedure form that people can go in and fill out, and that stays how it is. And then we were finding we had a lot of forms we were calling consent when really were just agreements. And I don't want to say it were just, they were agreements. They were just a different type of form that required a little bit different language when we were talking to the patient about what they're signing and why they're signing it. So this is them agreeing to participate in some manner with their medical care, and the organization indicating how they may or may not participate depending on the patient's participation. So, for example, a patient may agree to use a specific device or follow specific instructions pertaining to their care. So one of the examples I worked on quite a few times in our organization is using a home sleep study device. We found that that was an agreement type of form. It did not have quite as much when it came to the actual form and what needed to be on it. Again, we want the fully informed process, so everything is shared with the patient. But when it came to what the patient actually needed to sign, it could be a little bit simpler than the entire consent form. Other examples, a patient agrees to the cost for their care or device. The patient agrees they received information regarding their condition or care. And so again, some of the requirements our team worked on, again, that plain language. the team that we worked with came up with a way to define agreement. And then we must include what the patient is agreeing to and what the organization agrees to from a legal perspective. So let me show you what that template looks like. So again, you'll see some similarities. All of the yellow areas are the free text. That is where our employees are able to go in. They can name the form, they can put the information about what the patient agrees to, and then what our organization agrees to. So again, at the top, because it might be really hard for you to read, by signing this form, I agree to participate with my medical care. I understand that this form explains an agreement between myself and Henry Ford Health to work together. It describes what will happen if I follow the agreement and what will happen if I do not follow the agreement. And then it says this is an agreement about, and that's either a place that we can just reinsert the title, or we can give just a really brief explanation of the details that are to come. So this is an agreement about how I will use a home sleep study device, for example. So again, anything in yellow, that's what our employees fill out. Anything that is not in yellow, the employee cannot touch. That is locked text. That is for us to keep, and if we need to alter it, we can. That's, a conversation with the employer as well. The content writer, the person writing the form. But again, these are by and large the standards that we require of what an agreement form will look like. So authorization form and revoke authorization form. So a patient gives the organization permission to act on information related to their healthcare, or for revoke, a patient asks to take back or no longer grant the organization permission. So some examples are use of protected health information, audio or visual permission, information about healthcare. For example, I authorize Henry Ford Health to leave a voicemail regarding my appointment reminders. So some of the requirements, again, plain language, you'll see that on all of these, defining authorization, what that looks like. And then from a legal perspective, what the organization is requesting permission to do, and then how the patient can take back the authorization when applicable. So let me show you that template. So again, yellow, anything that the employee can go ahead and edit. Anything else is required and something they cannot edit. So again, at the very top, so for defining authorization, I understand that signing this authorization form means I give permission to Henry Ford Health to use personal information about my health and healthcare. This authorization, and then you'll see in yellow, that is where our employees can type in how long the authorization is good for, when it ends, or if it's a one-time authorization. For example, I allow my blood sample to be released to the police department. That's a one-time authorization. And so they would indicate that there. And then if that's an indication, we actually take out the how to take back an authorization, because we only are using this once. We make that very clear at the top that we're using this for a one-time use. And then after that, this authorization is no longer good. So once that information is released the first time, that's it. That's all this authorization is good for. So again, the reason for the authorization, that's where our employees get to go put the information. And again, we prompt them, what is Henry Ford requesting permission or authorization to do? What type of information is being disclosed? Why are we requesting permission for that? And then again, using the first person. So again, the how to take back the authorization is required. That's mandated by legal. That's not something we can remove. We have to tell patients they can take back an authorization in writing. But again, if it's a one-time use, we make that clear and we remove that section. So when we talk about revoke authorization form, again, a patient legally, at least here in the state of Michigan, only has to put in writing that they take back an authorization for those types of authorizations that they can take back. So we did this just from ease for our employees, was creating the revocation form so that an employee can help, has a patient with them and they say, oh, I want to take back that authorization. They can go ahead and fill this in and print it out and then have the patient just sign the form as their way of writing it. But again, this is not required. This type of form is actually not required. It's just something we found would be useful for our employees. And again, that's something you want to be clear on within your organization. And from a legal perspective is, do they just have to put it in writing, or does it have to be a particular form? So that was something we made very clear, was it's an option. They can use the form, but they don't have to. A patient just has to write out that they take back a form. So then government or regulatory forms. So these are forms that the government or regulatory bodies require to be written or formatted in a specific manner. So caveat to that to say, pretty much all of our forms, there's some sort of requirement, whether legal, whether regulatory, or government guided. However, a lot of them just say you need a type of form. Here's some of loosely what needs to be in there, and then they leave it at that. Whereas other types of forms require them to be formatted a specific way, or even they can't have our logo, they have to be exactly what they come from the state. So for example, in Michigan, a DNR form, do not resuscitate form, has to be exactly as the state mandates it. So it can be on our Henry Ford template. So I'll show you that template in a moment, which is basically just a blank template. But as far as what the language says, what it looks like, how it's written, that is required to be a certain way for us. So I am not able to do much with it. So when it comes to this type of form, the primary requirement is to meet the stipulations of the government or regulation agency. And then if possible, we'd love to address plain language defining terms, meeting formatting requirements. But again, the primary goal is just to make sure we're meeting the government or regulatory requirements. So again, this is a pretty blank draft. So this is what we would put our DNR information on. So basically it's just copy and pasted from the state. So I can't do much with it other than have it on this blank form. But again, we have the blank form, and if we're able, we'll try and define or outline a little bit better. The formatting will have kind of those headers if we're able to. But again, that's really just dependent on that type of form and what your state or regulatory body is requiring. So I just shared several templates with you, and things will look different at your organization. I think your teams will come up with what works best for you and your patients and things like that. So just again, some really general tips to keep in mind when you're designing your templates and thinking about standard language is, again, creating those clear headings. So we found kind of outlining those headings in bold, but then having the outline boxes were really helpful. And I'll share that on the next slide as far as our patient feedback. We found that particularly helpful to organize and make it a little bit cleaner and easier to follow. Things like 12, at least 12-point size font, if not bigger, ample white space. I would consider, this is something we found really, really helpful in our organization, is something that where you can lock the text. So we can share that template, but it isn't within Word, and we have the text locked. So only the people who have that code can alter any of the standard language if it's required. Otherwise, the employee can only edit the sections we give them permission to. And we found that really efficient and clear as we went through and reviewed the forms, and as we have people approving them, is we want that so that it's very clear what we need our teams to review and what standard. And then using bullets, of course, too, and breaking up information so it's a little bit clearer rather than just text on text on text. Again, language, plain language, try and identify that standard language that needs to be consistent on every form. So regardless of the agreement form a patient signs in our organization, they're going to read the same intro. And I think, again, that's really helpful. So you get that general, okay, what am I signing and why am I signing it? And then here are the details. And then identify the areas that will need to be edited, filled in based on the content. Again, set those standards for you and your organization. How should it be worded? Are you using first person or second person? And then include those tips. So like I said, in those yellow sections, we had tips about what we need from the employee in those sections. And then of course, working with employees, sometimes we have to go back and get more information. And then I've seen this a lot coming up in the chat, seeking patient feedback. So we knew from the very beginning we needed to get our patients involved. And when we were doing our process review and fact finding, that was just not a great time to get our patients involved, because we were just trying to wrap our heads around what in the heck is already going on. And then what do our patients need to give us feedback on? So we didn't need our patients' feedback on what's happening internally when it came to review and approval. We don't need their feedback on what legal says, yep, that looks good, or no, we need more from a legal perspective. We need them to review, at least in our organization, what we needed them to review was the templates, and the standard language. And then if we can, we'll get their input on some of the content specific language once we have that filled in from employees. So we had the opportunity to bring these templates to our patients, and we actually shared with them 3 of our old forms that really were just a bunch of text pasted on a piece of paper. And then we were able to share 2 of our updated forms with the templates I just shared with you. And we didn't tell them initially what they were looking at. We just said, we want your feedback on all of these forms. And every single person in that room immediately was drawn to the 2 updated forms. And this was some of the initial feedback we got. We got a lot more. We're still working with our patients as we navigate this process, but this was our initial response. And so again, we knew we were on the right track when we had these templates in standard language. They really liked the headings. It looked clean. Even though it was a long form, it didn't feel very long, and they felt more comfortable signing it, which again, this is all the feedback we really want to get initially. And they also helped us, as we made some tweaks and modifications to our templates throughout. So I'll pause for one moment. Do you think you could incorporate these types of forms at your organization? So another yes or no, just kind of thinking again, I went through a lot of information with the types of forms. So do you think, as you review or think about forms you've seen in your organization, do you think those specific types of forms I went over are something that you could easily apply? So go ahead and put yes or no. And for the sake of time, I'll just kind of keep going through the last couple of slides so we have a chance to get to Q&A. So our next step was updating the system process. And so again, this will look different depending on your organization. And so for us, we were talking about, okay, so what does it look like when our employee submits a form? What information do we need from them? Who's approving it? Who's going through? Who's reviewing it? Who has say in what is said or not said? And then who ultimately gives us the final sign off? And so basically you have your team, you have your templates, and now what? So this is where you want to really work with your stakeholders to identify the efficient process for review and approval. So for us, one of the things we worked on really hard up front was a decision tree for our employees. So we were finding that we did not have enough information up front. So we were looking at forms with almost zero context about why they were being created or who was requiring them. And when we started asking some questions, we would get, oh, well, the nurse on this floor just felt that we really needed patients to sign a form. And we were like, oh, okay. So we need a little bit more information. So we've required from our employees, again, the purpose of the form, are there regulatory or state requirements or even a department or system policy that supports the use of this form? And do you have leadership approval? Those were, again, we asked for more, but those are the three things we really honed in on as far as we need this information up front so that we're not all wasting our time on a form that we get to the end and everyone's like, wait a second, no, we don't need this form. So those were things that we worked on within our process for updating the forms. We identified technology that helped. So it turns out everybody was using all kinds of technology and not one of us was using the same platform. And so this was something we really had to work on and we're still working on as far as what is the project management system that helps us get through this process the most efficiently for everybody involved. And so there are different systems to consider. So for example, Podio, ServiceNow, Shared Drive or OneDrive, again, whatever it looks like for you at your organization. And that's not to say we promote any of these, it's just to say we all use something different. And so that's something to think about. You want everyone to try and get on the same page as much as possible. And there might be a learning curve, but it's worth it to get this efficient process and review and approval done so that we can make sure we're using the best forms for our patients. And then ultimately identifying the approval workflows. So again, you can see at the bottom, it kind of goes step by step, and sometimes it needs to bounce back. So if legal says, oh, wait a second, Becca, I think we need to have something like this. Can you plain language that? It'll bounce back to me. But ultimately, these are the people that give us the thumbs up. And they're not just individual people. These are councils. So our health literacy council, our legal council, our regulatory council. So these are multiple people going, yep, thumbs up from our perspective. And Helios for us is our Epic team and our IT team, who again at the end just builds it in. And so they may have some concerns from that perspective if needed. But again, this is our approval workflow. Again, it may look different for you, but that's something you can kind of start to structure out as you identify who needs to be involved and when. And then finally, outlining and implementing communication plans and dissemination strategies. So this is actually an ongoing opportunity, even within our organization. As I alluded to at the beginning, we're a relatively large organization. And so to get everybody on board who needs to know these things can be difficult as far as getting in front of the right people, making sure all of our frontline nurses and staff that have our patients sign forms know about this process. They know what the most up-to-date forms are, etc. So here's just some ideas when you think about communication and dissemination and understanding that this is really, really crucial so that we don't have people using old forms. We don't have people using the old system. We really want to make sure we're using the best, our best practices and our best forums, which are health literacy forums that we've considered. So leadership, team huddles, mass emails, system newsletters, road shows, lunch and learns. So getting actually in front of people in person, sending those mass communications, which we know sometimes are not always the best, but it's just a tool in the toolbox of making sure that you're effectively communicating and making sure all the right people know. So again, this is an ongoing opportunity that we're still working on within our organization. And so again, in the chat, if anybody has additional ideas of things that have worked really well in your organization, feel free to share those for the sake of everybody here, so you get to know, you might be inspired from ideas from other people. So again, those are the 5 steps we outlined. It's a lot of information. It's a lot that goes into each step. We would be always happy to talk to you further if there's information you want from us on something more specifically. But these are kind of the steps we really follow to really help us within our organization to make health literate patient signature forms and a more equitable patient signature process. So opportunities, again, I alluded to these already. So this is for an equitable patient signature process. So again, all types of forms, so informed consent, agreement, authorization. There's so much that goes into it. And so again, in the chat, I've been seeing a lot about how our providers are talking with our patients. And we know that that is certainly an opportunity that we're hoping to address as well within our organization as we continue to move forward. It just did not happen to be the one thing we could do more efficiently and effectively right away, but it is something we understand is important that we'll continue to work on. So again, I'm not here to solve all your problems. I'm just here to provide some, again, hopefully a few tangible steps for you when we talk about even just templates. That might be a really good first step of just updating what the look of the forms look like. And then as we, continue to move through the work, is working with our providers on making sure we're doing the fully informed process. So as we wrap up, again, just a reminder for our review and takeaways: collaboration is key. Find the right people to have at the table. Respect and use the various expertises. Focus on the access, understand, and empower to guide your work. Get a really good understanding of what's already happening so that you can really identify the opportunities rather than just jumping in without all the information. Revisit and update that elevator pitch as you work with more people. And then ultimately understand this all takes time. As I mentioned, we had one foot in the door, and that started 5 years ago. And so it's just been the last couple of years that we've really been able to do and move a little bit more in this space. And so know that this takes time. Know that we are moving the mountain one pebble at a time, and it can be frustrating. And yet we really are all in this together as we try to address this for our patients and our health literacy work. So here are the references, and thank you so much. I think I'll turn it over to Jill really quick. Oh, Jill, you're on mute, I think.
Thought I clicked it. Thank you, Becca. That was amazing. It was really enlightening and educational and a lot. So we have just a minute or two for some Q&A. If you've got questions for Becca about the content she presented, go ahead and throw them in the question and answer. There might be a little lag between you posting your question and my seeing it here on the backstage, but let me see. Yeah, so go ahead and we'll see if we have any questions. And in the meantime, I'm going to actually put some more information in the chat and see if I can do this without having it just be a big block of text. But while we're waiting, if anyone has any questions, I want to just thank you all for being here. I'm adding some ways that you can continue the conversation and stay connected here and through the health literacy discussion list. Be on the lookout for future webinars, including next month's webinar on July 17th, which is going to be about how to implement the 10 attributes of a health literate organization with Tom Bauer and Michelle Hecox of Johns Hopkins. So I'll add that information here. And we want to keep this conversation going in the discussion list. So did that come through? Looking to see. There we go. All right. Well, we might not have any questions coming through, Becca. I think maybe you covered it all.
Perfect. I would love to, if anyone has further questions, I think, Jill, you have my email. I'm happy to share that with the group.
Yep.
But yeah.
We'll be getting the presentation out And let's see. Oh, looks like I might have some questions. Oh, thanks. Sorry. Here's one. Yeah. Do we have a minute? We have a minute. So here's a question. Is there a review process involved? If so, how often do forms get reviewed? Where are the forms stored and who manages them?
Yeah, that's a great question. So yes, there is a review process involved. So as I mentioned, we have those stakeholders. So our team review once the information is put into our templates, our team reviews it, legal reviews it, regulatory reviews it, and we all have to get a thumbs up from our councils, and then our clinical leadership also approves it within their council. So there is a review process. Our forms get renewed every 3 years. They can get updated sooner if needed from a regulatory or legal standpoint. But from our perspective of keeping track, they do get updated every 3 years. And a lot of times it's just checking back in with the employees saying, is there anything that needs to change? And if not, we'll move it through. And it usually moves through that approval process pretty quickly because it's already done that. And so as far as the storage and organization and who manages them, that falls on our team. That's something we took over. So as I mentioned, health information management did that for us for a long time. And that's something we've taken over. So we are the ones that own all of the final versions of the forms. We have an intranet page where we store them that actually not everybody has access to. So where everybody else finds it within our organization is our system called Policy Stat, where they can go in, and that's where the most up-to-date forms live for them. And then on the back end, we store and manage all of the forms, again, for the purpose of making sure people are using the most up-to-date type of form. So I hope that answers the question.
And here's a different, but another review question. Do you use PMAT or any other of those tools from a health literacy perspective to review forms?
Yeah, so something we have within our group, we have various checklists that we follow that we've pulled in things, require things from PMAT, from other places when it comes to health literacy, plain language, and best practices. So within our organization, we have those checklists that we follow. So similarly, when it comes to a form from a health literacy perspective, that's something we follow. So we have standards that are required and it must meet all of those. And if it doesn't, that's where it gets flagged on our end and we work with the employee to change it.
Awesome. There are a few more questions, but we're out of time. Please, everybody, if you are a member of the Solution Center, and if you're not, you should be, it's free. Go ahead and register. You can go to the discussion list and we can continue the conversation there. Thank you, Becca, very much for your time. Thanks, everyone, for coming. And we will see you in a month. Have a good one, everyone. Bye.